Welcome to Lesson 2, Monitoring Diabetes. When you complete this lesson, you will learn the following: why it's important to check blood sugar, how often you should check your sugar, what is a normal blood sugar range, why the A1C lab test is so important. In Lesson 1, you learned that when you eat too many carbs, sugar will build up in your bloodstream. In Lesson 2, we will discuss what it means to monitor your diabetes. In other words, how to make sure your blood sugar is at a normal level, not too high or too low. In this lesson, we will use the term glucose, which means sugar. A glucose meter is a device used to monitor the level of sugar in your blood. Similarly, you monitor the fuel gauge or speedometer on your dashboard. How often should you check your blood sugar? People who use insulin to manage their diabetes should test their blood sugar several times a day. Fasting blood sugar is taken when you wake up, having nothing to eat or drink for at least 6 hours. If you use insulin to manage your diabetes, for the sake of safety, always check your blood sugar prior to driving a motor vehicle. If you take insulin before meals, you should test your blood sugar prior to taking insulin. Test more often if you have had low blood sugars below 70, sugars have been unusually high, over 200, you are sick, flu, or infection. What is a normal blood sugar range? According to the American Diabetes Association, or ADA, target blood sugar levels are, before meals, between 70 to 130. 2 hours after meals, less than 180. Targets or goals are something to work towards. Participating in diabetes self-management education will help you to hit your targets. Why is the A1C test so important? The A1C test is a blood test that shows a person's average levels of blood sugar over the past 3 months. Sugar particles stick to your red blood cells. The A1C test measures the amount of sugar particles. The higher your blood sugar, the more sugar particles stick to your red cells, and the higher your A1C will be. Your doctor also uses the A1C to determine how well your medication and insulin is working. If your A1C remains high, your doctor may increase your medication or insulin dosage. Summary Review 1. It's important to check your blood sugar frequently, especially before driving. 2. Fasting blood sugar is when you haven't had anything to eat or drink in 6 to 8 hours. 3. If you use insulin, always check your blood sugar prior to driving a motor vehicle. 4. Target blood sugar range before meals is between 70 to 130 and less than 180 after meals. 5. The A1C is a test that shows your average blood sugar over 3 months.